Good afternoon, everyone. My name is Hannah Holt. As part of the Advanced Pathophysiology class at UTA, going to explain my design plan for a lesson on myocardial infarction. So let's go through each aspect of the lesson plan and then use a lesson on myocardial infarction to help explain each one of those aspects a little bit further. So first, all the content standards for this lesson came from the American College of Cardiology, as well as the specifications manual from Joint Commission. So all of the content standards came from those two publications. So first of all, in this lesson, to get the students thinking about heart attack, because these are first semester students who may have not had exposure in the clinical setting yet. So to get their mind thinking about this topic, I would just propose the discussion to them. Have you ever had a heart attack? Has anyone in your family ever had a heart attack? And then just leave the floor open for discussion. Allow them to discuss back and forth with me about heart attacks. Additionally, there's some videos on YouTube, patients who've had heart attacks, that talk about their own personal experience with dealing with it. So I could display one of those videos as well. And that just gets their mind thinking about the topic that's fixing to be discussed. So this first slide here is talking about course outcomes or goals. So these are general concepts or ideas that we want the students to have achieved at the end of this course. So one of those is to be able to explain the pathophysiology behind a myocardial infarction. So for this lesson, we want them to identify regular circulatory system, what's normal. We also want them to recognize when something's abnormal. So we want them to be able to know the pathophysiology behind a myocardial infarction. What's going on inside the body that's causing something to be wrong. This next slide here is specific course objectives. So these are lesson specific and they're more detailed information. They tell the students exactly what we want them to have learned at the conclusion of this specific lesson. So one of those is to be able to identify pharmacologic and non-pharmacologic therapies for patients who are having a heart attack. The second is to be able to identify interventions that they can do that would help decrease myocardial workload. And the third is to be able to collaborate with other team members to pick up and prevent any dysrhythmias. So this next slide just talks a little bit about the target audience for this lesson. So this lesson is designed for classroom students, nursing students, specifically first semester nursing students. All would be adult learners, and it could be either an ADN or a BSN program. Now with this myocardial infarction lesson specifically in mind, you could easily translate that into a lesson for general public, take out a little bit of the medical terminology and some of the pathophysiology behind it, and stick more with the risk factors and lifestyle modifications and treatment options. And you could be able to use this lesson for the general public. So this next slide starts the information section or the knowledge section. This goes into the pathophysiology behind a myocardial infarction. It talks a little bit about some of the major causes. It identifies one of the major causes as being a buildup of plaque. It also discusses some of the signs and symptoms that are pretty common associated with a heart attack: chest pain, nausea, radiating pain. And then it also discusses two different types, non-reperfusion and reperfusion. And then it also discusses some of the common treatment options, aspirin and nitroglycerin. So this is your information section. This is the part of the lecture where students get all the new knowledge. This next slide discusses some common risk factors that patients have for heart attack: smoking, tobacco use, sedentary lifestyles. It discusses gender as well, men versus women, and age, how that plays into patients who have heart attacks. This next section here talks about prevention. So what can we teach our patients? What can the students learn that they can take into the clinical setting and teach patients about preventing heart attacks, whether they've had one in the past or they're just trying to make some lifestyle modifications? So some specific examples here are limiting tobacco products as well as long-term exposure to secondhand smoke. So if they themselves don't smoke, but if they're around someone who smokes all the time, that's also a risk factor, so identifying that. Encouraging daily exercise, heart-healthy diets. All these changes that can be made to help reduce their risk for heart attack. This next slide discusses a little bit of how we evaluate students at the conclusion of this lesson. So we would create a multiple choice quiz that tests students on their knowledge comprehension. So this is an example of a question. It has the stem of the question and then 4 different options. There would also be some select all that apply questions. There would be hotspot questions that have a picture and students have to be able to look at the EKG and interpret what's going on. There could be some listening questions to listen to different cardiac sounds. So that would be a quiz. Those would all be included on a quiz to test the students at the conclusion of the lesson. This next slide discusses different aids, different tasks that we have the students complete to help reinforce the ideas that were taught throughout the lesson. So the first one is to have students complete a crossword. This crossword reinforces the first objective, which is identifying pharmacologic and non-pharmacologic measures that would be used for patients with a myocardial infarction. So they would have the clues that would be given, and the answers would be some of the pharmacologic or non-pharmacologic measures, and they'd have to put them in the crossword. They could work together as teams on this, again, encouraging teamwork, collaboration amongst themselves. The second part is a simulation. So this is a high fidelity simulation where you use mannequins that can mimic or simulate a patient having a heart attack. So this would have students recognize interventions that they can do that would decrease myocardial workload. Also, as a follow-up to the simulation, you can have students journal. This lets them reflect on their personal experience in the simulation, things that they would do differently next time, things that didn't go well in their eyes, and give them an opportunity to kind of evaluate themselves in that simulation in the role of the nurse. That reinforces objective 2. And then objective 3 would be reinforced by having a guest speaker come in. So near the end of the lesson, after they've had their knowledge section, we'd have a guest speaker come in. This could be a fitness coach from the area. It could be someone from cardiac rehab. It could be a cardiologist. It could be someone who's had a heart attack in the past. Just someone from the community that would come in and discuss with the students a different aspect of treating a patient with myocardial infarction. So this helps reinforce objective 3, which is collaboration, so working together. This next slide here would be anticipated questions that students would have. So there's one example here. What kind of follow-up care are required of patients after they've had a heart attack? So this would be an opportunity for you to explain appointments with doctors, different dietary restrictions they'll have now, new medications that they'll go home with. This is an opportunity to teach students about medications that are required for patients after they've had a heart attack. And then this slide here is a slide of references that I've used. This is where we would list any of the resources that we accessed and used for this lesson. And that's an explanation of the design plan that I've developed. This design plan was on myocardial infarction. Thank you.